In 2012, the residents of Travis County voted to continue a legacy of caring for the community by approving Proposition 1, which is providing support for the Dell Medical School and other innovative activities here in Travis County.
Well, one of the great things that's come out of Proposition number 1 and getting the new medical school and the new modern 21st century teaching hospital is that what it's going to do is it's going to leave a lot of land that we've always known as part of our health care in this community, where right now University Medical Center Brackenridge is located. It's going to leave it open for future activity. And so the real question is going to be, what will that activity be and how will it help further the mission of Central Health?
In 2004, a referendum took place in May in which the voters of Travis County voted 55 to 45% to create Central Health. And as part of what happened and what the voters were told is that the Brackenridge Hospital tract would convey from the city of Austin to what is now known as Central Health. It's a great responsibility, and it's something that has been a challenge, but a treasure for our community for a long time.
Edwin Waller was the first mayor of Austin, and he declared the campus where Brackenridge sits to be a public facility. I see Central Health as continuing that legacy.
Central Health's property is absolutely critical to the health mission of not just the school, but of Central Health's larger health mission. And with it being right next to the med school and the new hospital, it's a critical sort of juncture between what happens in this kind of public area and what can happen and bridge over into the private.
So with the new campus redevelopment, it'll be a significant contribution to helping us realize an elevation of the care provided in Central Texas and increase education so that we'll have physicians that'll go out and take care of patients in the right settings.
We have and continue to undertake a robust community input process, which is helping us to gather information to prioritize and also provide aspirational ideas for the redevelopment of our Brackenridge campus.
I think that Central Health has made a very concerted effort to go out into the community and receive feedback.
The most interesting and really wonderful thing happened as part of the process. The project evolved as we listened to folks.
This project took on board, kind of early on community engagement. And before we formulated as architects a lot of design ideas, we had a lot of input about what's the responsibility of Central Health and the community that they serve.
The very first thing we heard was, find some way to make this piece of land more penetrable. That's what we currently have there is impossible to get through or to. And so we came up with the idea of reintroducing the street grid so that it's more accessible.
Because currently it's a big mega super block that's hard to get into and out of. And so putting the street grid back in is going to help with transportation, mobility.
Tree-lined sidewalks, dedicated bike lanes, taking advantage of the proximity to the park, opening up, in fact, a promenade to the park.
Through this process, we've learned that the community does support a mixed-use approach to the development of the property to maximize its value so that we can, in turn, invest that value back into the community in the form of improved health care.
The community has strong feelings about having health care close to where they live or work. And so I'm very excited to see this development serve as a potential hub to connect downtown with the University of Texas.
I think what a project like this is capable of doing is really opening up people's eyes, hopefully, and their hearts to this new notion of healthcare and health and wellness, and make it really clear, physically clear, that Central Health is there for our community.
The most exciting part of the development, and I really can see this with a lot of confidence, and that has to do with the market that we're proposing. I see the market as almost like a Central Health, our board's contribution back to the public. It'll be a gathering area. It'll be very uniquely Austin.
Getting this notion of the market space in here as a major public space and then pulling it in to the Waterloo Park area is going to be a very powerful thing that says, first and foremost, this is your place, this is your space.
Probably you will not see any buildings going up anytime prior to 2020. So sometime after that, you'll see real development occurring. However, our market, we'd like to see get going sometime, right along the time we're doing the streets, we'd like to be going with a market project.
Central Health has a once-in-a-lifetime opportunity to develop a vital community asset and transform the way healthcare is delivered to the community.
Travis County is great because it really has stepped up to take care of all of its people and provide health care for everyone here. And also Travis County's been great because they've been ready to do it in new ways, recognizing that old ways just are inadequate to meet the needs of the community.
The benefit of this level of collaboration between Central Health, Seton, and the Dell Medical School really will help us build a healthier community. We're really rethinking the delivery of care. The level of innovation couldn't happen alone, but when you bring all three partners together, new ideas and new thoughts, that's when we really get that energy to say we really can make this happen and we really can transform the delivery of care for Central Texas.
I think that this tract and what might happen on it together with the medical school and with the teaching hospital and all the other activities that are going on around this are a once-in-a-lifetime opportunity.
This is going to be like a incredible renaissance for this portion of the downtown, and not just the downtown, but everything that it touches. Hopefully that love will spread throughout the whole county.
10 years from now, we're going to look back and we're going to say they kept their promise. We're a bit more healthy city and more healthy community than we would have been otherwise. And look at what we're doing from an economic standpoint for all segments of Travis County.